Optus has agreed to pay a $100 million fine for selling phones and services to vulnerable customers who didn't want or need them.
$100 million is a fair whack for Optus for something the ACCC is calling unconscionable. That's just a fancy way of saying it was a dog act. And how else would you describe sales tactics that targeted the vulnerable, people with mental disability, and Indigenous people living in very remote communities? So what were those tactics? I'll tell you. Putting pressure on people to buy products they didn't need, not explaining the terms and conditions, misleading customers to believe goods were free when they actually weren't, and this one takes the cake, not even caring if the customer didn't have Optus coverage where they lived. So to add further insult to injury, Optus then set third-party debt collectors onto these poor people, and that was after the telco had launched its own internal investigation into the dodgy dealing. So a $100 million fine for Optus? I guess it starts with yes.
Well, doctors are growing more concerned about the speed respiratory illnesses are spreading across the country. New data shows parents not getting their children vaccinated against the flu is contributing to the sharp rise in cases.
WA is in the middle of a horror flu season. Hospitalisations have doubled, cases have doubled. So what is going on? Here to help us understand that is Director of Infectious Diseases at Mater Health in Brisbane, Professor Paul Griffin. I'm curious to know, Paul, as an infectious diseases specialist, after having gone through a global pandemic where we've saw so much loss of life and so much of that could be prevented by little things, hand hygiene, wearing a mask when you're not feeling well. As an expert, how do you feel when you see people in the workplace coughing, sneezing, not wearing a mask, not using the old hand sani? Must drive you up the wall.
Look, it's challenging, and especially when, as you say, we know the impacts of these infections can be devastating, and to know that we have simple interventions that make such a big difference and they're being underutilised for a variety of reasons is potentially frustrating. And, I guess that's why we have the jobs that we do have to try and improve all those things, because we know that they work and we know that the impact of these infections can be devastating. And so, while there's an element of frustration, I think it's also, important that we realise we need to perhaps try and do as much as we can to address these challenges. And, I completely understand that there are a lot of issues to do with vaccination in terms of complexity and misinformation and things. And that's why I just encourage people to, get their information from good sources.